When Warnock brings up rabies, he's not choosing a random example. Rabies is one of the clearest illustrations in medicine of why prevention systems make.
Secretary Kennedy, you're here today to defend the president's budget request. In September, you said that the CDC, quote, will again become the world authority on infectious disease policy. Do you still stand by that statement, yes or no?
We already are.
Secretary Kennedy, do you know what rabies is?
Rabies?
Yeah, do you know what it is? Okay, so
Yeah.
rabies, people contract rabies, as we know, through bites from infected animals like skunks, foxes, like raccoons,
Yeah.
and it can devastate a family. When a pet is infected, it is very serious. It's 100% fatal in humans
Yes.
if left untreated, and generally it's a horrific experience. Staff at the CDC Rabies Division in Atlanta, Georgia, have historically been able to field emergency calls 24/7 from providers about complex rabies cases using CDC expertise to determine appropriate care. Secretary Kennedy, since you and President Trump took office, do you know how many people are left to staff this 24/7 line?
I do not know, Senator.
Okay, so the answer is one. So I want you to know that there's one person left to staff a 24/7 line to respond to rabies, a disease which left untreated.
You know how many
is fatal.
rabies cases there are every year in the United States?
So I'm asking the questions. The CDC's infectious disease work has been so decimated under your leadership that there's only one person left to staff the line and respond to families about this very deadly and terrifying infectious disease. Let me ask about another disease. Secretary Kennedy, do you know what prion diseases are?
Yes, I
or no?
do.
Okay, thanks. And when you think of prion diseases, one of them would be mad cow disease.
Mad cow disease.
And diseases like mad cow disease can be transmitted from animal meat to humans, and it can cause a rapid onset of dementia, challenges with walking, personality changes, and severe insomnia. It's also 100% fatal, and there is no cure, with people's brain tissue essentially turning into a sponge before death. Do you know which office at CDC monitors prion disease? So
I do not know, Senator.
it's the Prion and Public Health Office. Do you know what population is most at risk of contracting the disease?
I would say it's people who eat meat from CAFOs.
Yeah, so hunters. Prion and Public Health Office is critical in a state like Georgia. In Georgia, we have a lot of hunters. There are more than 600,000 hunters in my state, but your budget proposes to eliminate this office. Respectfully, you seem distracted, Brother Secretary. Why does your budget propose to eliminate the CDC office that focuses on monitoring this deadly infectious disease that's especially a risk to rural communities? Why are you proposing to eliminate the office?
There's a lot of cuts at the agency that nobody wants. We have a $39 trillion debt. We've been asked to cut across the agency 12%.
I assure you that the 600,000 hunters in Georgia would want this office. They would want the protection. I assure you that families that are dealing with rabies or the prospects of that would want to know that somebody's going to answer the phone when they call. You've come to Congress and justified destroying the CDC by saying you want to just restore the CDC's mission to focusing on infectious diseases. Yet you're also gutting the very offices that keep American families safe from disturbing and deadly infectious diseases.
Senator,
sir, hold on, sir.
Senator, there's 1 to 3 rabies cases a year in the United States. I think one person manning that office full-time probably can handle that traffic. In terms of prion disease, it's very, very rare.
I beg to differ. Here's the issue, and we see this across the board with CDC. The incredible folks at the CDC in Atlanta, Georgia, they protect us every day from the threats that we don't see. And they don't get much credit for it because of the stuff that does not happen. And it's okay for the general public not to wake up thinking about that. But we expect you to keep Americans alive. And the cutting that we're seeing, these draconian cuts for an agency that you said you wanted to restore to be the leader in infectious disease, yet you're cutting the coverage of infectious disease. Personally, sir, even as you seem distracted while I talk to you about deadly diseases, I think you're dangerous to the American public, and you ought to be fired. And if you're not fired, you ought to have the decency to resign. You're way in over your head.
What makes this exchange so striking is how Raphael Warnock doesn't just argue policy, he reframes the entire conversation around what government responsibility actually looks like when it comes to public health. Instead of debating abstract budget numbers, he pulls the discussion into real-world consequences, where timing, expertise, and preparedness can mean the difference between life and death.